Okay, so here's two questions about saturated and unsaturated fat. Okay, so clearly we find that saturated fat increases your cardiovascular disease risk, it increases your insulin resistance risk, and it increases your risk for type 2 diabetes. So how much saturated fat is okay to eat? Is it binary? You either have some or you don't, or is it a sliding scale?
Yeah. So, I mean, and I think it is a spectrum with the goal being, and again, what we're talking, so the goal being as little as possible. The American Heart Association still talks about 7% of calories in your diet being from saturated fat or less, whereas the current concept by many other experts out there promoting the low carb, high fat diets would be saturated fats 15 to 20, 22% kind of range, with total fat being maybe 50, 60, 70, 80. Totally different spectrum. So, I mean, how powerful is a small change? And really, we have to think, I think, in the past about 24 months, the Harvard School of Public Health has published, and they're observational studies. We're not going to have a 100,000 patient study where 50,000 eat an all plant diet and 50,000 eat some version of the paleo diet. We're going to follow them for 20 years. I mean, that's a dream. It's not going to happen. So we got to go with what we got. We got to go with Loma Linda and Blue Zones and Adventist and other data sets, whatever they are. So the Harvard School of Public Health has been tracking nurses and doctors for over 30 years in the Nurses Health Study and the Physician Health Study. And they have this crazy large database. And they didn't just take one dietary intake at the beginning of the study 30 plus years ago. They go back and repeat dietary assessments, so they get updated information, one of the strengths of their data set. And they've shown that recently that whatever measure you want, total mortality, cardiovascular events, if you substitute small amounts of saturated fat decrease with polyunsaturated fats like healthy oils, which I'm not a fan of oils, but canola oil, organic, and olive oil are clearly better than butter, lard, and ghee. You can detect major differences in drops. So they published in the last 3 weeks, Zong, I think is the first author, Z-O-N-G, but if not that, is very close, that just 1% reduction in the amount of saturated fat. So if the American Heart says 7%, you go down to 6%, and you replace it with either complex carbs like legumes, beans, and fruit and vegetables, or even polyunsaturated fats like canola oil and olive oil. You can document about a 10 to 13% drop in dying from heart disease with just a 1% decrease. So, I mean, that's a powerful statement. Each 1% drop, you learn how to, substitute butter with using, some organic jam, and you substitute, cheese with nut-based cheeses, which may have oils, and well, they have fats. They may not have added oils, but there's not going to be any immeasurable saturated fat. And think every percent you drop is another notch of lowering your cardiovascular risk. Still the #1 killer of men and women in America, sometimes tragically at very young ages. This past week in the clinic, I saw a slew of people that had heart attacks in their 30s or early 40s. They were seeing me somewhere down the road in their progress because they were concerned about the future, as they should have been. So 1% change in calorie intake, saturated fat matters. So it's a spectrum. Go as low as you can. I mean, there's this huge debate over avocados, and I think you're going to get to a list of asking me good, bad. And that's the one thing I got to put my hands up. I don't know. Nobody's studied avocados and endothelial function, avocados and plaque progression or regression. Avocado oil, I wouldn't go near, generally, or at least use it instead of butter, lard, and ghee in a very tiny amount. But the sacred avocado is splitting the food movement into polar expanses, and we've got to have an international avocado agreement that comes up. I really mean it. It's literally nuts that it has a nut in the inside. We can't figure it out. So except for, if you're really trying to lose weight, I would stay away from whole avocados, and I wouldn't eat 5 a day. But I'm pretty happy with avocados in the diet compared to what people are eating. I mean, donuts and cheese, peanut butter crackers out of the gas station.
You were saying how this affects young people. We were just talking about a study where I think that it was like kids in Kentucky or something.
Oh, you and I were talking about, yeah. So, well, the obesity rates in kids is, scary. What is it? About 10% of 5-year-olds are categorized as obese, and by the time you get to 22 years old, 2022, but that's what the study like that, it's up to about a quarter of all 22-year-olds are obese. But yeah, but actually in Louisiana, Bogalusa, Louisiana, you got to love the name Bogalusa. Dr. Gerald, Professor Jerry, I apologize your last name for a minute. He's been tracking kids by an ultrasound of their carotid, a very accurate way to look for early silent plaque. And 10, 11, 12-year-olds, I mean, routinely, maybe because it's the South, and we do know that the Southern diet is one of the worst examples of the Western diet there is, because there's just more fried food than the average Western diet. But, you know, to document that there's plaque in 10, 11, 12-year-olds pretty routinely, and that was actually studies done 25 years ago. I am certain, although I can't quote you the reference, it's going to be more common now because obesity is highest in the South. It's absolutely tragic, that little triangle in Mississippi, Georgia, Louisiana, and obesity in adults and children. A whole bunch of theories why it is there, and some of it is environmental toxins, which is very interesting in the cotton industry, in addition to fried food.
Okay, this is fantastic. Dr. Greger also talks about the fact that people who eat meat-based diets and or dairy-based diets show signs of heart disease as early as 10 years old. So maybe he's referencing that same study or a collection of studies that show the same thing.
Yeah.